Jared 200, what's up? Okay, so we're going to continue on the week of June 3rd through the 10th in our second non-communicable disease. It's a non-infectious disease. We're going to go right in here. We discussed CT1 already, and we already went through diabetes. We go in here, okay? Again, we were looking at these chronic diseases of aging, these non-communicable diseases that are such a burden on society. If we look at the financing and the economics, it's the burden on you as an individual, as for your family, okay, in terms of not only caregiving for you and supporting the person that has these diseases, but we look at Medicare and the costs and things like that at a society level. So it's a big deal. We come in here to diabetes. We already went over this. We talked about, we hinted towards the concept of metabolic syndrome. We come back over here now again, and we are now going to get into what's called diabetic heart disease. Okay. Now, what we did on this particular situation is we downloaded all the PDF files from diabetic heart disease. Okay. The National Heart and Lung Institute has changed things a little bit, so they have ischemic heart disease. But they also, you'll see as you read through this, we refer to what's called the metabolic syndrome. So I put the link in here for metabolic syndrome. If you click right there, it's going to be coming up here in a sec, okay? So it goes through what is metabolic syndrome, their names, okay? All these different parts, insulin resistance syndrome, okay? So it's piggybacking what we're talking about. Has obesity, okay? There's lots of things. What are the causes, okay? So we go through this, and there's all these different problems. The metabolic syndrome is a combination of being overweight, okay, obesity, with the diabetic condition that we already talked about right here, insulin resistance, okay? And then some of the other problems that are associated with this syndrome, okay? You can then, look at what in terms of what's the diagnosis, okay? So we're going to see, I referred to this last time, a large waistline, okay? And then we're going to look at your bloods, triglyceride levels, your HDL, which is protective, happy density. It's called high density lipoprotein, but it protects you. It makes me happy. We can look at your LDL cholesterol, okay, your total cholesterol, your blood pressure, and also in concert with diabetes right here. So we can look at your fasting blood glucose, okay, and other things like, remember, hemoglobin A1C, which is much better. Alrighty, so that's what that's all about, okay? You get in here, and then we can click on this PDF file. And we ask all about diabetic heart disease. And again, it gets into this condition, this concept of diabetes and insulin resistance. We see that, what are the blood vessels that get impacted? The giant blood vessels are the ones that get the most of this condition that is called atherosclerosis, okay? And that is the caking on of plaque on the inner core of your blood vessels. The big blood vessels are the worst, the coronary artery coming to your heart, the carotid artery going to your brain, and the renal artery going to your kidneys. Those are the big ones, and they get really hammered, and so then what you have is stroke. You have a heart attack from the coronary arteries that supply the blood to the heart, okay? So we see right down here, again, the plaque narrows the coronary arteries, okay? Reduces the blood flow, and the heart muscle then begins to die off. We need the amino acids from protein to make new heart muscle proteins. We need oxygen, glucose, because the heart never stops. And when that happens, and it's long enough, you have a heart attack. And whatever tissue dies off, that's heart failure, okay? And the person that's a pathologist will look at the heart, the cardio, look at the muscle, the myo, okay, and they look at the pathologies. That's cardiomyopathy. All right, so please go through. I'm not going to look at all these, but familiarize yourself with coronary artery disease. It's the #1 cause of death in developed countries like ours, okay, and it's linked to diabetes and this metabolic syndrome, okay. I'm going to get rid of this. This is not working. This is. All right, so you click on here, and it takes you to this concept of what atherosclerosis is. All right, it'll start with a little commercial, okay, and then you just click out of there. I put in an ad block, but I haven't, and it's about atherosclerosis. All right, awesome. And you'll learn all about the plaque formation. Okay, so when we look at these diseases, okay, they really impact the lifestyle of older people, of older Americans. We're going to talk about it. So we have this great video on social workers. Okay, they, if you are hospitalized, are part of the medical team, a crucial part of the medical team, to ensure that when you are released from the hospital, okay, that they dispatch the right people to ensure that you have the right care. Okay, they're going to make sure you are hooked up with a physician that's going to monitor your well-being, make sure the pharmacy has your medicines set up, make sure you know what your medicine is, your pharmacy needs. If you need a ride to go see the doctor, they'll set you up there, and then they're going to make sure that you are set up in terms of your activities of daily living. Is somebody there to help you eat, somebody there to help you clean yourself and your house? What is your well-being? Okay, they go in and they diagnose your particular situation, and if things don't look right, then they come up with social treatments to make sure that you have the right things in place. Maybe you have a deadbeat son, okay, who's not going to help you out. Then they're going to replace that person. They're going to go through the court system and replace that person with somebody that is legally responsible for your well-being, okay? Alrighty, so what kinds of problems do they encounter? Well, they encounter a lot of elder abuse, and this is an amazing video right here. Okay, it talks about it. So I really encourage you to watch this video. It goes over a lot of really heartbreaking stories. 16 minutes. It's a worthwhile 16 minutes, and it goes over the different aspects of elder abuse. So, physical abuse. Okay. They're vulnerable, they can't defend themselves, and the unsavory segment of society will beat up on them, okay? Sexual abuse, yes, it happens routinely, and it's really, really horrific. Then we look at fiduciary or financial abuse. It's a huge problem, and it is a problem within families where deadbeat children will go in there and take away their money, or you have these scam artists, okay, that are out there door to door, on the phone, internet, and they will steal the other person blind, and they have no finances then to cover their needs for the rest of their life because they're too old to work. Okay? The last kind of abuse is called neglect, where somebody is responsible for their well-being and they don't do anything, and they just neglect them, and all aspects of everything we've talked about happen. Okay, if you see yourself someday being that person that is going to make a difference, this is a great hour-long video. So this is like careers, guys, down the line, where you see yourself being a lawyer. This is actually a forum that was run by the District Attorney's Office in San Diego talking about elder abuse. So it's a long video. It's for the officials. You guys don't have to watch it. This is the DA with witnesses and talking about what he encounters. So maybe some of you see yourself being an attorney or a social worker or just an advocate for older people, and this would be a really cool video for you to watch. Okay, guys. So I look forward to your discussion of care systems. Okay, it's really, really important that you get in there and you discuss things that are going on. It's a big segment of society. At the very least, you are going to be in charge of care of your parents and grandparents, and there's a chance that your parents or grandparents maybe live in New York and now you've moved to LA, and so you got to find the right type of people that will help you, and a social worker will do that. Okay, guys, you take care, and I'll see you next time.